They are saying the worst patients are the caregiver. They always have criticism and feedback to give you. However, you will learn from them as much as you hate to be pointed out your mistakes. This is Nusaiba. She is second-year respiratory therapy, and she is in her first clinical, excited to meet her first patient. Doing what she have learned in school, proper hand hygiene, and following the precaution. And here's her first patient today, but wait, she's a nurse. You will surely learn a lot today.
It's been an hour. The doctor hasn't come, even the nurse. I'm so tired, I cannot breathe.
Don't worry. Nusaiba's job is to help you breathe.
Hello, Ms. Shahad. My name is Nusaiba and I'm a respiratory therapy student. And respiratory therapy means that I'm gonna check your breathing and make sure that your lungs are functioning properly.
Introducing yourself is always the favorite part.
Ms. Shahad, let me check your name and date of birth. Shahad Ahmed, February 4, 2003, and healthcare number is 37443489. Okay, Ms. Shahad, can you please tell me why you are here today?
I did a nose surgery 2 weeks ago. My face is painful. I cannot feel my nose and I can't breathe. I feel like my nose is blocked. Especially when I sleep, I cannot breathe. When I lay down.
Let's see what she'll go with after she takes the vital signs.
Okay, let me check the oxygen saturation and also your blood pressure.
Oh no! You can't make mistakes, especially with this patient. You'll now receive a heavy critical look.
The cuff pressure will affect O2 saturation.
Let's fix it.
Now, Ms. Shahad, I'm gonna check the oxygen saturation and also the blood pressure.
The blood pressure cuff stops blood flow when it inflates, and it can block the pulse needed for pulse oximeter to read accurately. This is not normal. We have to intervene.
Now I'm going to listen to your breath sound, Ms. Shahad.
You mean you'll auscultate me?
Exactly. Can you please take a deep breath through your mouth?
Yeah, I know, I'm a nurse. I already know.
Sure thing.
Your vital signs are all seems fine and within the normal range, but your auto saturation is a little bit low, so I'm gonna put you in auto device. I'm gonna prepare everything and I will be right back, Ms. Shahad.
Let's get what you need for this patient ready. After filling large volume nebulizer with water, connect it to the corrugated tube. Then connect the connector piece to the face tent. Next, connect it to the other end of the corrugated tube. After connecting the flow meter to the wall, connect the LVN. For SpO2 of 89%, the flow should be 10 letters per minute, and the FiO2 is 60%. But wait, when exactly can I use the face tent? 1. Post-operative facial or oral surgeries. 2. Patients needing mild to moderate oxygen concentrations. 3. Patients needing humidified oxygen. 4. Claustrophobic patients. Why did Nusaiba choose the face tent in particular? First, this patient had nasal surgery, so she needed a device that wouldn't touch the sensitive surgical site. Second, since her SpO2 is moderately low at 89%, it's best to administer oxygen using LVN with a face tent. Third, LVN combined with the face tent provides humidified oxygen, preventing crusting around the nose. Now, let's apply this to the patient. Make sure the face tent is tightly around the head and that the chin part is in the correct place. so that the patient breathes oxygen molecules properly, and also monitor for the presence of mist in the face tent.
I need you to take a deep, nice breath through your mouth.
Make sure it's tight.
Now you're doing it right, Nusaiba. We don't want the nurse to question your skills. Some things to check before leaving are that the corrugated tube is not too long, which causes condensation of water molecules, and that the water inside the LVN is not less than half full. Let's wait for the treatment to end.
Hello, Ms. Shahad, how do you feel now?
I feel much better.
Okay, good. Now I'm just going to check your blood pressure and also your oxygen saturation.
Yes, these are the vital signs we love to see.
I will listen to your breath sound. Can you please take a deep breath through your mouth?
Make sure to always guide the patient, even if they tell you they know, or a nurse, for example.
After the treatment is done, there is no any complications such as skin irritation, CO2 rebreathing, or drying airway mucosa. Since your condition is stable, Ms. Shahad, we can gradually wean you, and I will suggest to the physician to prescribe nasal saline spray as well as keeping your nose moist. Thank you, Ms. Shahad, and I hope you get better soon.
Always ensure patient privacy and safety. The last step is to write down everything that happened with Miss Shahad. Sorry, I mean Nurse Shahad.